Things change. That is an unequivocal fact of life. And this fact of life kept coming up in my head as I was preparing the speech on the coronavirus because the total number of cases and corresponding deaths for the coronavirus kept increasing in my outline. And for context, and to kind of set the tone for this presentation, the total amount of cases globally at the point of this presentation, which is the 17th of April, is upwards of 2 million, and the total amount of cases of deaths globally is close to 150,000, actually a little bit above that. And the US accounts for close to 40,000 of those deaths. And this information comes from daily reports compiled by the World Health Organization and the US Centers for Disease Control and Prevention. No one is free from the exacerbating control of COVID-19. You may have heard that older individuals and people with pre-existing medical conditions affecting their heart are more at risk for death, and that is true, but that does not mean that young individuals such as you and I cannot get infected and possibly spread it to our loved ones, and as such we have to take it seriously. I myself have been rigorously researching this subject, keeping myself posted with day-to-day news, and as such I am prepared to inform and consequently persuade you as to why this disease and pandemic is something that cannot be taken lightly, even for young people such as you and I that may think that we may be invincible to this disease. Today I'm going to discuss the severity of the COVID-19 pandemic, why it's been so hard for nations around the world to combat the spread of this disease, and what we can do on our own ends to slow the spread of this disease. So, coronavirus disease 2019, aka COVID-19, is a highly contagious respiratory illness that has and continues to rapidly spread globally around the world. And the reason it's so contagious is that it spreads through water droplets, and water droplets are created when we speak and breathe, and it can spread 2 to 3 feet. And that's why healthcare officials are recommending that we stay 6 feet apart just to stay on the safe side. And water droplets can also spread when we cough or sneeze, and they can spread hundreds of times farther than 2 to 3 feet. And they enter the body not through your skin, but through your mouth, nose, or eyes. And as such, you can see as to why it's been so easy for the coronavirus to spread globally at this pace. It's actually been growing exponentially. And for context, on January 22nd of this year, there was about 580 cases globally. A week later, there was close to 8,000. And then by the end of the following month, there was upwards of 86,000 cases globally. And I already mentioned that right now there are 2.1 million cases, or a bit more than that. And for comparison reasons, the population of San Diego, according to the U.S. Census Bureau, is at around 1.5 million, so there's more people infected globally with the coronavirus than the population of San Diego. Okay, so why would this all matter technically if everyone was getting infected but then it wasn't lethal? And so in regards to that, the mortality rate of the coronavirus, according to WHO Director General Dr. Tedros Adhanom Ghebreyesus, and I quote, globally, about 3.4% of reported COVID-19 cases have died. By comparison, seasonal flu generally kills far fewer than 1% of those infected. So when one hears 3.4%, they might think that's not that much, but I remind you of that statistic that I gave you. 150,000 people have died globally by this point, and so that 3.4% may seem more significant to you now. And also that takes into account all demographics, not people that are just more at risk to die from the coronavirus. So, the coronavirus itself is already highly contagious, but there have been several factors that have enabled it or not allowed us to combat the spread of the coronavirus. And one of these is the testing shortage or a lack of test kits. Narrowing our view to the US, according to Christy Juliana, who is the executive director of the Big Cities Health Coalition, there is in fact a testing shortage that is causing a lagged response of COVID-19 by our entire country, contrary to what our president has sometimes stated. And so this testing shortage means that healthcare workers don't know who exactly is infected, causing them to not be able to give an apt response to this pandemic. Additionally, hospitals are in dire need of more ventilators and PPE standing for personal protective equipment. And that's the gowns, the face masks, and the goggles that you see healthcare workers on the front lines wearing to protect themselves from the coronavirus. And ventilators help people who are already infected as this is a respiratory illness, and it helps them breathe so that they can stay alive. And the fact that there is a shortage with PPE is according to American Hospital Association's Senior Vice President of Communications, Alicia Mitchell. And additionally, some people are still gathering in large groups. I'm sure you guys may have heard that this past spring break, a lot of college students traveled to Florida and partied it up. And consequently, a lot of them were infected because they were not going by guidelines and they were gathering in large groups, and some of them have even died. So while our situation may seem bleak, there are still some things we can do to help ourselves and others. And one of the main things that you can do is don't buy away PPE resources from doctors and healthcare workers that truly need it. Remember, that's the personal protective equipment, the gowns, the face masks. The people are just buying them and hoarding them, but we truly don't need them. We can maintain social distancing. Healthcare workers don't have that luxury. They have to be on the front lines helping people like you and I, and they're not even able to come home and see their families. We want to support them in any way that we can. Another good thing to do is maintain hygiene. That hygiene being washing your hands, because if the coronavirus is on your external skin, you can still wash it away. It's not going to enter your body through your skin. One of the things that you want to do is, if you have the habit of touching your face, stopping that habit, because if it's on your hand, you can spread it to you can allow the coronavirus to enter your body through your mouth, your nose, or your eyes. And another main thing is to cover your cough or sneeze, because as I mentioned, the water droplets, which is how the coronavirus spreads, can spread hundreds of times farther through a cough or sneeze than 2 to 3 feet. And so you really want to block that cough or sneeze too. So if by chance you're a carrier and you're holding the disease, you don't want to spread it. And the thing that I'm sure all of us are maintaining, but I want to stress this, and that I hope all of you guys are maintaining this, is staying at home. Even though it might be tempting and we're all going through this difficult time, we all have to stay at home. And it's, even if you think that young people such as you and I may be invincible because there's a lot lower chances that we'll die, there's even a chance that you may become a carrier and bring it home, and someone who may not be as lucky, or one of your loved ones essentially, might suffer a complication, and it's just better to stay at home and not suffer that chance. Okay. COVID-19 is running rampant right now, and is something that cannot be treated lightly, and as such we must give it its due attention. So the coronavirus itself is highly contagious, and its spread has not been facilitated. It has been facilitated due to a lack of resources by our nations globally, and just due to some negligent individuals who aren't willing to follow guidelines. We ourselves can help by maintaining good hygiene, staying at home, and making sure we don't buy resources away from healthcare workers that truly need those materials. I want to end with a quote by Ernest Hemingway that goes, "Night is always darker before the dawn, and life is the same. The hard times will pass, everything will get better, and sun will shine brighter than ever." We can and we will get through this together. Stay safe, and I look forward to being able to see all of you when this pandemic ends. See you then.